about our project, and I will tell a bit about making a healthcare startup, why to make a healthcare startup and why not to make, what are the problems that we will find. All right. Okay, so our platform is giving you access to doctors. So it's simply like having a doctor in a pocket. You can make a consultation with a doctor using web, mobile, or mobile apps. So we got doctors on duties. You can connect with them in a few minutes, and after that, the doctor can prescribe you a prescription, can send you to another doctor. Thanks to the legislation that entered to Poland in December, right now we are the medical diagnosis. So a few years ago when we have started, it was consultation with a doctor. So you had an education talk with a doctor, because the legislation doesn't able to in Poland to give the diagnosis remotely. Doctor had to talk to you physically, and after that he can prescribe you the prescription. In December it changed. So why people are using our service? They are using it because they want to save a time. So they don't want to travel to a clinic, they don't want to spend a time with other sick people in a queue, and they want to do it fast. Because there are some problems that you don't want to go to a doctor because you feel it's something very little, and you are shy to ask a doctor about something silly. We are cooperating with large companies. I will tell you after that what's our business model, but first let's start with how everything has happened. So I met with my co-founder, and it is my first and last advice for you. What is the most important when you are starting a startup? I will never start this new startup, new business without a co-founder. It's very important to have a person that is someone who has skills that you don't have, the person that will have in mind what's your vision when you are starting to not believe in your project. The co-founder is the most important thing you will have in a project. One of my other company, which is a software house, I'm owning myself, and it has a lot of problems that we don't have in Telemedico because I got a co-founder over there. We have met on Startup Weekend in Łódź, and we are probably one of the teams that still developing their project after the Startup Weekend. Startup Weekend is an event when you are, and probably there was a Startup Weekend maybe even in this place. Yeah, you are going there, for people who don't know, you are going there, you are pitching your project, or you are joining to a team that is creating a project on the Startup Weekend. After that you are pitching this project, what you did during a few days in front of the jury, and after that you are doing it further, or you are leaving this project and not doing anything else. So we have met over there, and after that we are still developing the Telemedico. After half a year, what we started first was create an MVP. MVP was containing only functionalities that you can schedule a visit with a doctor. So doctors were putting their times in a calendar, and users can go to the calendar, and like on Znany Lekarz, you can only schedule a video consultation. So on a doc planner you are visiting doctor offline, and on our platform you could only make a video consultation with a doctor. And with this functionality we moved to Wayra. We had been accepted to the Wayra Accelerator, which is run by Telefonica, and we spent 1 year in the Czech Republic. The acceleration program started for us with a jury. So 13 people were sitting in a table in a row, and they were asking us questions. We answered, and from 150 applications we have been chosen to join Wayra. Two of these people who were in jury were also business angels. So they approached us after 2 months of being an accelerator and asked if we want them to join our board and get the investment from them. These guys from scratch were looking at us. These 2 months for them was something like looking at these guys, at us, and find if they are working very hard and if it will happen or not. So right now we can only go to the Telemedico. You can choose a doctor or simply start a consultation, and in 30 seconds you will get a connection to a doctor. So we got doctors who are general practitioners, and they are paid to be on the duty, that whenever you will call, there's someone online. And we got doctors with specializations, so you can still make a consultation with them, but you have to schedule, you have to make an appointment with them first. Why people are using telemedical? When we were starting our startup, of course, we had some hypothesis that we will be service for people who are young, probably who are women, and they will talk about children, etc. Right now, the reality shows that most of people are using telemedical because they got an embarrassing problem. They are using chat, text chat. They are talking to a doctor in a text chat, not only video chat. Other group are people who had offline visit, and right now they want to ask a doctor about a second opinion. So doctor said something that is not for them very, very sure, that they want to talk with other doctor if it will be if this doctor was right. So when we also started to make new campaigns, when we were approaching new markets, a lot of people from UK started to call us, and not English people, but Polish people who are living in UK, and they are not feeling safe when they are talking about health with an Indian doctor, etc. Because there are a lot of doctors who are not British, and even when there's a British doctor, Polish person is not feeling comfortable speaking about her or his health in different language than Polish. And of course, our consultation is much cheaper when compared to going to a doctor in UK. After each consultation, we are making 2 surveys. First survey is to ask if the consultation was right. I mean, if the doctor is okay, if the feeling, the user experience of having an online consultation is something good. And other survey is sent after 5 days. We are asking people if they need an offline consultation after online. And results are, with a 70% of consultation with a GP, with a first contact doctor, 70% is not in need to going to the offline doctor. So only in a 20 to 30%, a person after our consultation had to go to a doctor because it was something serious. Of course, sometimes people are calling us with broken legs, etc. But via online we can do anything. Most of cases that people are calling are when you get the health results, because it is the first question: what I can do, what I can talk to a doctor via online. The doctor has to make a diagnosis based on a physical touch, etc. No. In a 70% with a general practitioner, patient didn't need to go to a doctor offline. What was the most important when we were starting? Like every marketplace, you got 2 sides or more, even in other marketplaces. We got a side of doctor and we have a side of the patient. So when you are making a marketplace, this is the second advice from me, take care about first side of marketplace as fast as is possible in other way than building it normally. So in our case, the life hack was to hire doctors. And after hiring doctors, we didn't need to take care about their calendars, etc. Simply we are paying them, and you have to be on duty. And right now, 100% focus is going to the patients, to put as many patients as it is possible. When there's not enough doctors to serve this number of patients, we are simply hiring next doctor, etc., etc. So right now, most of our doctors, because it is very, very hard group to recruit them, most of them are coming from the network of our doctors. But you can imagine that when we were starting, we didn't have a network of doctors. Right now, we are available in Poland, in the Czech Republic, and in UK. But in UK, it's mostly for Polish people who are living there. In the Czech Republic, this is something what Accelerator also gave us. Being 1 year in the Czech Republic, we met a lot of people. One of these people, one of person that we met was a guy who is owning a medical facility. He had 20 or 30 doctors, and he started to be our franchisor. The dog planner. When I'm making right now the presentation, this is the most important thing that people are asking, how the investment of the dog planner begin. If you don't know, dog planner, the owner of znanylekarz.pl has invested in us 1 million zlotys. The process was very fast. I mean, talking with Mariusz and his co-founder, it was maybe 2 weeks. And after that, it took 2 more months, but it was talking between lawyer and our lawyer. But our time